How do you know if you are negative? Is there a test? Yeah, there's a couple of tests that you can do to test yourself for herpes. Something I really want to be adamant about here, and it's really frustrating and very confusing. This is one of the reasons why the majority of the population has herpes, and yet we don't know and just we keep on spreading it. Is because if you go into your doctor and say, I'd like to get tested an STI, STD, and unless you specifically ask for herpes, say, I want you to include herpes, it's not included on the panel. Testing is really two ways. I was saying three because you can also be clinically diagnosed by someone actually viewing an outbreak and saying, okay, that looks like an outbreak, you get the symptoms, it's called a clinical diagnosis. The second way is doing an antibody blood test, is when they're checking your blood for antibodies. And then the third way would be if you actually have an active outbreak, you can have it swabbed, and then the virus or the DNA from the infection or from the blister would be sent off and looked under a microscope.